Have you ever experienced severe neck pain that you can't turn your head, can't move your arm, or stiffness that is so bad that you have to turn your entire body when turning to look at someone? I'm Dr. Nicholas Chua, Medical Director and Pain Physician at the Specialist Pain International Clinic in Mount Elizabeth, Novena. And today, I'm going to share with you the various causes of neck pain and some proven methods that have helped many patients with this condition. There are two general types of neck pain that you are going to be concerned with. The first type, which is more common, is axial neck pain. Axial neck pain refers to pain that is only localized to the neck. The second type is radicular neck pain or shooting pains. And in the cervical spine, these pains are because of a pinched nerve or an impingement of your cervical nerves that radiates down the arm. The second type is, of course, more worrisome for most patients. So, axial neck pain, which is localized pain in the neck, can come from any of the structures in the neck. This can range from muscular pain, pains in the joints called facet joints, or pain from the disc, which are the small sponge cushions in between two bones in the cervical spine. Any of these structures, when they hurt, can cause pain that's localized in the neck. Now, in the younger individuals, say below the age of 40, a discogenic cause, which is a disc pain from the disc, is more common. In the higher or older patient groups, degenerative causes such as facet joint degeneration, osteoarthritis of these joints can be a cause of your neck pain. Now, for the radicular causes, now this is often a bit more scary. Can you imagine pain resulting in tingling sensation or numbness that goes down to your thumb or to your index finger or to your middle finger? Sometimes this is associated with weakness or numbness, and to a patient that is not aware, this could be a sign of an impingement or pinched nerve in the neck, or worse still, impingement or stenosis of the spinal cord, which means your spinal cord function may be compromised. Now, the most common cause of this, again in the younger individuals, is a slip disc, and a slip disc can compromise the canal that the spinal cord is traveling in, resulting in a compromise of the function of the spinal cord or the nerve roots. Now, in the older individuals, a slip disc is not often a common cause. Degenerative causes such as the hypertrophy, which is the increase in size of the surrounding structures like the ligaments or the joints, can also compromise the diameter of the canal, resulting in a compromise in the function of the spinal cord or the nerve roots. Now, treatment of these two large groups of problems, it's very dependent on what structure is really involved. So we eventually need some form of imaging, and the gold standard of any imaging of the cervical spine is an MRI. An MRI will be able to tell us what structure is causing the problem and whether that problem is causing an impingement of the nerves or the spinal cord, and treatment will follow thereafter. The simplest form of treatment is, of course, to do nothing. Rest for a couple of days. But if that doesn't help, taking over-the-counter medications like paracetamol or even ibuprofen can help. Well, seeing your GP for stronger painkillers or nerve medications can sometimes be a good thing to do before you end up seeing a specialist, but I would suggest doing some physio, doing some stretching exercises before you embark on seeing a pain specialist or an orthopedic or spine surgeon. Now, when you see a surgeon or a pain specialist, they will recommend procedures or even a surgery when warranted. What does it mean when warranted? It means that they see a structure compromising the function and the integrity of your spinal cord or your nerve roots. And if not treated, this can result in long-term and serious consequences. Now, if conservative measures such as physiotherapy and medications are not working for you, then your pain specialist will offer targeted procedures, targeted injections that actually reach out to the problem that we see on the MRI. So for example, if you have a pinched nerve, a steroid injection directly to the pinched nerve can actually help alleviate the pain to a very, very significant degree. Now, beyond steroid injections, there are even procedures that target the slip disc. There are even procedures that targets the tear in the disc, and there's even target the degenerated facet joint. Now, when all these measures failed or you still have persistent problems, it is probably time to consider surgery. Of course, many patients are concerned with the risk of surgeries, but today we have reached such an advancement in spine surgery that some of these risks have been mitigated. Now, with a full assessment, with a proper MRI, your pain doctor will now be able to devise a personalized and definitive treatment plan for your chronic neck pain. This will enable you to live life to the fullest and improve your daily function and quality of life.